Hello, I'm Dr. Paul Beckman from All Seasons Full Body Chiropractic Center. Today, I guess I'd like to go over just some issues that have kind of come into the office here just this week here. I've had some patients that have come in that have had some pain in their jaw, or they have some issues with their TMJ joint. And the big thing that we need to kind of find out here when people come in that have TMJ issues is that do they actually have TMJ dysfunction, or TMD, sometimes you'll find in articles online. So most of these people are going to have, one of 12 different things possibly as presenting things going on. They could have literally just jaw pain. They could have jaw crepitus, meaning that their jaw kind of cracks and pops when they open or close it. They might be grinding their teeth. They might even have their dentist telling them that from grinding their teeth that they're ending up causing some pitting, usually at the base of their teeth. You could have some difficulty opening your mouth. You should be able to open your mouth, literally it's hard to see here, 3 fingers or 2 knuckles worth. So being able to get that into your mouth, that's how far you should be able to get your mouth open. Some people even have some difficulty closing their mouth. The interesting thing is, most of the time when I find that, it's the patients that have been into their dentist. They've had their mouth kind of cranked open for a period of time, having some kind of dental procedure done, and now all of a sudden they cannot close their mouth because the articular disc that sits on top of the condyle of the jaw gets stuck in front of the, in behind the jaw, behind the condyle, and then they can't close their jaw because that articular disc is trapped back there, not allowing them to close their mouth. So usually it's kind of key to get that kind of adjusted and reset so that you can establish a normal pattern for the joint to function again and get those articular discs back on top of the condyles there. A lot of people then, if they've had some long-standing issues with the TMJ joint, are going to have headaches. They could even have some pain in their upper neck, because a lot of the muscles that attach to the jaw are attaching to the front side of the cervical spine as well, and that could cause some strain on those muscles and then cause some irritation in the joints in the neck, so end up having then joint pain. Occasionally people will have some tinnitus, which is ringing in the ears, usually because of the muscles being tight, which then can kind of restrict some blood flow or cause the blood flow from the carotid arteries or even the vertebral arteries going up to go in a tortuous or a kind of a winding pattern that they then hear as tinnitus in their ears. Other people can have tracking problems with their jaw. Their jaw will kind of open, kind of in a J kind of pattern off to one side, or it can literally just kind of veer straight off to one side. Occasionally it'll kind of wind back and forth in a Z or S kind of a pattern when they're opening their mouth. Those can indicate different things that are possibly going on that we need to evaluate, so we make sure that we're giving a person a correct treatment plan to help correct this for them and give them a long-term relief from this. You can also have some muscle weakness. Usually I find that mostly with jaw opening, because when we test jaw opening or have a person open up their jaw against resistance, probably the only other time they've done this before was speaking to a spouse or significant other, and if they do have that weakness there, it does indicate there's some issues with the TMJ joint, and again, we'll evaluate that a little bit further to make sure that when we are again developing a treatment plan for them, that we're going to get corrected for them. Occasionally people can have some issues with vision, mostly because of the tension from the muscles and even the headaches, because you get the temporal muscles on the side of the head getting nice and tense. They can develop some trigger points, and sometimes that'll make it feel like you have some strain on your eyes, and people can have some difficulty focusing, or possibly have even tracking issues with their eyes just because of the strain that they have due to the jaw. And occasionally some dizziness can happen with patients, again, due to the jaw being tight and the muscles in the upper neck being tight, and possibly causing some restriction in some of the blood flow going up to a person's brain through the vertebral arteries and the carotid arteries in the neck. So If you have some TMJ problems going on, where if you notice any of those symptoms there, give our office a call. You can always come in for a complimentary consultation, and we can let you know what we would need to do to kind of proceed forward, or even if this is something that we can help you with. If it's not, we'll make sure that we get you sent off to the appropriate person, so that we're not wasting your time. We want you to get the best results possible here. So if we can help you, we'll let you know that. We'll let you know exactly what we need to do. We'll take you through those tests and procedures, and after that, we'll outline a treatment plan for you, so you'll know exactly what it's going to take to get it treated, how much it'll cost, all that kind of stuff. So again, any questions that you have, you can give a call at the office here at 701-356-0016, and hopefully we can at least sit down and talk with you and help you determine what you need to do here to help get that jaw problem cleared up. I hope that helps. Have a great day. Bye.